In the mid-1800s, a terrifying mystery haunted one of Europe's largest hospitals. Healthy mothers entered the maternity ward, only to die days later from a disease nobody understood. 1846, Ignaz Semmelweis begins working at the Vienna General Hospital. He notices something strange. The maternity ward staffed by doctors has a much higher death rate than the ward staffed by midwives. Women were so afraid of being admitted to the doctor's ward that some preferred giving birth in the street. Nobody knows why. At the time, doctors believed diseases were caused by bad air, miasmas, atmospheric conditions, supernatural explanations. Nobody understood bacteria. Nobody understood germs. The germ theory would not be accepted until years later. In 1847, Semmelweis's close friend Jacob Kolechka dies after being accidentally cut during an autopsy. The symptoms look eerily similar to the symptoms suffered by mothers dying from childbed fever. This is the moment everything changes. Semmelweis begins to suspect that doctors are carrying infectious material from dead bodies directly to living patients. Doctors and medical students are ordered to wash their hands with chlorinated lime before examining patients. The results are astonishing. Mortality drops from roughly 18% to around 1 to 2%. In some months, no mothers die at all. You would expect doctors to celebrate. Instead, many reject him. Why? Because accepting his findings means admitting that doctors themselves had been killing patients. Many physicians are offended. Others simply cannot understand the idea because germ theory does not yet exist. Semmelweis spends years trying to convince the medical community. His frustration grows, his career suffers, his mental health deteriorates. In 1865, he is committed to an asylum. He dies only weeks later from an infected wound. Ironically, infection is the very thing he spent his life trying to prevent. Years later, Louis Pasteur confirms germ theory. Joseph Lister introduces antiseptic surgical practices. The world finally realizes Semmelweis was right.